All right. I'm hitting broadcast and going live now. So everything now all the attendees will be able to hear us as soon as I hit this. So
Great.
three, two, one. Well, good morning, everybody, and welcome. We're going to give all the attendees an opportunity here to get logged on and get situated, and we'll begin the program here in about 2 minutes. Well, good morning, and thank you for joining us for today's programming on returning employees to work and some of the key steps to reopening our economy. We are pleased to be joined this morning by Ed Bardelli, Amanda Fielder, and Steve Palazzolo, all attorneys with Warner, Norcross, and Judd. I think just a few housekeeping items before we begin the program this morning. All the participants' audio has been muted during the program just to allow our panelists and presenters an opportunity to get through their presentation. We're asking you that at the bottom of your screen that you would utilize the Q&A function located at the bottom of your screen to submit questions. You can submit those questions at any time during the presentation. We'll certainly do our best to get through all those questions, either addressed during the course of the presentation, or we'll allow some time at the end to get through those questions. If for some reason we're not able to, if you look in the chat section, we have placed information in there, and you can certainly reach out to Ashley Willis at the Lansing Regional Chamber of Commerce. Their email address is in there, and we will make sure that we can connect you with Warner, Norcross, Judd, and see if we can get your questions answered from today's presentation. We are recording the presentation. We'll be able to send that out as a link afterwards, as well as the actual slide deck from today as well. So again, we're certainly pleased to welcome Ed, Amanda, and Steve this morning, and I'm going to turn it over to, I believe Ed may kick us off here. Thank you.
Thank you for joining us today. We're pleased to be able to meet with you and walk you through some of the questions that you may have as you bring employees back to work. What we are going to be discussing today is when to safely bring employees back, how to communicate with your employees, the decision-making process regarding who you will bring back to work, and what you should do with those employees who may refuse to return to work. We will then end with a question and answer session based on some questions that Ed, Steve, and I have received from some clients, as well as the questions that you submit to us today. First, Michigan issued its revised executive order last week, Friday, which continues the stay home, stay safe order until May 15th, 2020. The order that came out on April 24th opened some additional very limited businesses, but in essence, however, most of you are still not operating. Manufacturing operations are limited to critical infrastructure workers and those who are necessary to maintain minimum business operations, including protecting the value of inventory and equipment, ensuring security, processing transactions, and facilitating the ability to work for other employees. President Trump unveiled guidelines for opening up America, which included a three-phased approach to help state and local officials reopen their economies. And it was emphasized by him that there would be deference to state governors and counties on how they chose to do that, with some 3 phases outlined, as well as the criteria that will be needed in order to open. Governor Whitmer, after the April 20th press conference, has provided additional information as to what her action plan for reopening Michigan might look like. That will definitely include phases, and she has indicated that it will be phases based on industry and potentially region. This was information that was shared with her reopening plan on Monday, that was provided by the Michigan Economic Recovery Council, that indicated that an entity identifies the following framework for making return to work decisions, including workplace risk and pandemic risk. The Governor Whitmer's office and advisory team has identified 9 job categories, ranging from offices to industrial manufacturing plants, and is working with the University of Michigan to develop risk scores based on those workplaces. Those risk scores will be based on worker interactions. How often do employees interact with each other, the public, or use shared tools? Workplace characteristics, for instance, do employees work indoors or outdoors? And worker type, what are employee demographics and transit options? She also noted, as I indicated previously, that the decisions will be based in part on geography, and her advisors have divided the state into 8 regions based on employee travel patterns and the location of healthcare facilities. One of the important things to emphasize is that without knowing what the phase up process will look like and when we are to operate again, we need to start planning, but those plans must be flexible. You should have contingent plans. As many have acknowledged, it's possible that we'll see a resurgence in cases. So if the stay home at restrictions could be put in place again in the future to some level or degree. So as the initial stages of your planning process, you should consider not only the plans for Michigan to reopen, but also the plans for other states in which you engage in business activities. Each state, like Michigan, has its own executive orders that you need to comply with that may include additional requirements for bringing your people back to work safely. Ensure that you have reviewed the guidance for each of those individual states. And consider who from your workforce can continue to telework. If telework is working for your organization right now or a subset of your employees, continue those employees to do so. Again, this is a long-term focus. As most of you have seen, if there is a COVID-19 diagnosis, there is a 14-day quarantine concern. And so the more people that you bring back to work and open up for that opportunity and that infection will lengthen that quarantine process. As you plan, the best means to ensure that you are safely bringing back employees is to put yourself in your employees' shoes. Walk your facility from the start of a shift throughout the day and identify a checklist of activities and interactions your employees may have with each other. Focus on people, flow of people, processes, structure, and equipment. For instance, for social distancing, you are required to keep employees 6 feet away from each other at all times, if practical. If that's not practical, you may need screens or other separation. Visualize social distancing during shift changes, during meal breaks. You may consider staggering your start times or your break times to ensure that employees can keep that required 6-foot space. You will need to increase sanitization throughout your facility. This may include extra hand washing stations, Lysol wipes. Consider replacing air filters. And most importantly, create documentation policies for your disinfecting procedures to ensure that you are compliant. When it comes to your common areas, consider closing spaces that are not necessary. Lunch areas, conference rooms, shared spaces, lockers, vending machines. All of these are areas in which multiple people will use throughout the course of the day. If you don't need them, close them. If you cannot close those spaces, implement restricted use measures. Again, that may require staggering your start times or your break times to limit those in-person contacts. Ensure that you have the required PPE in your facility and enough to last you. This may include face masks, face shields, hand sanitizers, or gloves, depending on the type of work that your workers perform. Finally, if you are in a shared building, don't forget about the landlord or the general facility requirements. You should invite a conversation with those individuals to ensure that your employees are safe as they enter and exit your facility. Once you have identified all these issues in the safety checklist, you will then be ready to begin developing the protocols needed. As many of you have seen, the executive order from Governor Whitmer has required for some time, and is in the current order that was issued on April 24th, that you develop a COVID-19 preparedness plan that's consistent with OSHA recommendations. This will need to identify baseline safety prevention measures, develop procedures for prompt identification and isolation of those who are sick, identify worker risk levels, in what category those workers fall in, determine controls based on those risk levels, and then implementation of that plan. There are a lot of preparedness plans available on the internet. Most of our clients, for instance, look at the plan that's available by Lear, and that was great that Lear has shared the 40 pages that they put a lot of work into. But please note that a preparedness plan is very facility specific. You will need to walk through that plan and make significant changes based on your particular facility, your workers, and the work performed by your individual workforce. For instance, one of the points is what your response plan is to a COVID-19 positive test. You will need to immediately separate the employee from other employees, and you will need to inform other employees of possible exposure. Please note, you cannot identify that individual that tested positive. For all individuals who have had close contact for a prolonged period of time with the positive test individual, in the CDC that says that that means 10 to 30 minutes, they also need to stay home for 14 days after the exposure, self-monitor for symptoms, and follow CDC guidelines if symptoms develop. You will also need to close off, clean, and disinfect all areas used by that sick person and other potential common areas. When you're talking about preparing to implement, please make sure that you've identified a responsible person for ensuring that the plans you've worked so hard to create are followed. In addition to a preparedness plan, there are other protocols and safety protocols that you need to develop. Certain counties across the state, for instance, have required specifically employee screening. Oakland County requires a daily screening program for all staff showing symptoms, which, by the way, that symptoms list has now been updated by the CDC to include an additional category of symptoms, whether they've both been in close contact with other individuals that have tested positive for 14 days or whether they've traveled. You also should consider your existing policies. Do you need to update your sick leave policy or your FMLA policy to incorporate the new rules from the Family First Coronavirus Response Act? If you are going to stagger shifts and have people take breaks in different areas, do you need to update your attendance policies? As you work through those protocols, you'll want to consider those policies as well. How do you communicate with employees? It's an important part of the process. This is the process that's going to invoke the trust. This will be crucial to establishing that relationship. Communicate with them on the expectations of resuming operations. This includes not only their expectations as individual employees, but also your own expectations as an organization. Provide updated information when those protocols or updated impacts are changed. Identify that person who's the point of contact for employees if they have concerns about the safety protocols or employees' failure to follow them. Start with an employee training on all of your new procedures and protocols. You should be messaging to your employees now that you are working through those processes. You should plan for training the first day that they come back, and then reinforce that training daily, whether it be with updates, alerts, or signage throughout your facility. But this will help not only ensure compliance by your workforce, but will also help you make employees feel safe. We received a few questions from clients on HIPAA concerns and whether or not, if you have a positive COVID-19 test, what scope and what information you can share. Please note that this is not a HIPAA concern. HIPAA only applies if you are a healthcare professional sharing information about a patient or you're getting information from your health plan, both of which are improper even under COVID. The issue is confidentiality under the ADA. The CDC has given us guidance on what to do with a positive test, and you need to inform other employees of their possible exposure, but you must maintain the confidentiality of that positive test employee as required by the ADA. Again, if you are also conducting screening measures, if you have a facility located in one of those counties that imposes those other screening measures, all the results of that screening also need to be kept in a confidential medical file. And I briefly touched about this earlier, but finally, the key issue is to show employees that you have made the workplace safe and that you'll continue to make the workplace safe. We'll talk about this a little bit more throughout the presentation, but we are in a new normal. The workplace will not look the same as it has for the generations past. It will be a long process in making employees feel comfortable to perform their jobs safely, and will continue to be a multifaceted challenge for your organization. But the success of reopening your operations will depend on your workplace feeling safe in your facility. So now that we've talked about how to communicate with employees, I'm going to turn it over to Ed, who's going to focus more on how you make those decisions.
Thank you, Amanda, and good morning, everyone. So my part of the presentation does focus on making those decisions when you're bringing employees back and some of the considerations that you want to keep in mind when you're doing that. So one of the first questions you might have is, well, does everybody come back at once? Or, how do we do that? And again, this is the last point on that slide, but I do want to be clear that, everybody could be working, but we're talking about bringing people back to the physical workplace. And it's likely that you won't be bringing everybody back at once. It's consistent with the phasing that we've seen both from the federal and state government. And Amanda showed you a couple of slides with respect to how the governor is looking at phasing in bringing employees back to work by segment in terms of the industries that you're in. But I think this also will filter down to how you bring the workforce back. So when you're looking at that, it really is, you want it to be consistent with the social distancing guidelines and other CDC and OSHA regulations. You're probably going to stagger people coming back and looking at staggering shifts and understanding how your workforce physically works in the particular location. So who do you bring back? Well, first of all, you should analyze who's needed. Who do you have to have physically present in the workplace? We've been emphasizing that, and I believe the government has been as well, that to the extent that you can have people effectively telework, they should continue to do so under the current state of affairs. If you do have to have people back who can't telework and need them back in the physical location, you have to determine who's needed. And then one of the things you need to do is have a conversation both internally among management and then with employees about who can come back. A great place to start, and of course to minimize risk, is volunteers, people who are willing and able to come back and want to come back and they're needed. That's a great place to start. When you're going through that decision-making process, however, you do need to keep a couple of things in mind. The anti-discrimination statutes that we're all familiar with continue to apply. So all of the equal employment opportunities laws that we're familiar with, the FMLA, the ADA, age, sex, and race discrimination statutes, all continue to apply. Just because we're under a state of emergency, we've got this global pandemic going on, doesn't mean that an employer can make any decision that it thinks it should make without regard to these particular laws. So please keep these in mind. Of course, we've got the FMLA and the ADA considerations, but we also have now these new emergency paid sick leave and expanded FMLA leave laws that are on the books, at least through the end of this year, under the Families First Coronavirus Response Act. Keep in mind that an employee who has COVID-19 still has FMLA rights, just like normal. You'd still need to provide them with leave and go through the same processes that you're already familiar with. Also keep in mind that COVID-19 itself would likely be considered a disability. So you've got a duty to engage in the interactive process and provide a reasonable accommodation for an employee who has COVID-19. Also keep in mind, as we've seen, that telework and leaves of absences are reasonable accommodations. And you also want to make sure that you document the interactive process that you're going through with the employee. I mentioned here age, sex, and race discrimination statutes, and we might be thinking, well, you know, how do those really apply? But be mindful of them under this current circumstances. For example, when you're looking at bringing employees back, you want to treat all the employees the same, regardless of the protected category they might be in. For example, you don't want to treat people who are 65 or older that may be considered in a vulnerable category different than someone who are in younger categories. So you're treating a segment of your workforce differently than others. Those same categories apply. And also keep in mind, we've got state law restrictions that we're all familiar with that mirror the federal law. And I did want to point out that the most recent executive order from Governor Whitmer on the stay home, stay safe that extended it to May 15th, that's 2020-59, it specifically called out the Michigan Elliott-Larsen Civil Rights Act when dealing with employees, especially those who are wearing masks. Sorry about that. We had a little technical difficulty. So we just got done talking about the employment laws that you need to be mindful of when you're bringing employees back and making decisions with respect to bringing employees back. So what are things that you can do when you're bringing employees back? Well, first and foremost, you can obviously require employees who have COVID-19 to stay home. And if employee has a confirmed case of COVID-19, you are allowed to require them to get medical clearance before they return to the workplace. The EEOC has clarified that under the circumstances with our healthcare system being taxed right now, it may not be the classic doctor's note that you get, that the employer should be flexible in terms of the medical clearance that it gets from an employee. It could be an email or other kind of communication from the healthcare provider. but the EOC has stressed that it wants employers to be flexible with respect to that. You're also allowed to take the temperature of those entering the workplace, as well as ask questions about any symptoms. Keep in mind when you're doing this that the confidentiality concerns that Amanda already raised, in addition to the fact that we know people who may have COVID-19 are not always symptomatic. So they may not always have a temperature or have any of the other symptoms. So it's still important to make sure that you maintain all of the guidelines with respect to having people at the workplace that Amanda went over already. You can also choose to administer COVID-19 testing to employees before they enter the workplace to determine if they have the virus. Now you need to make sure that you're using a test that's accurate and reliable, not something off of the internet or sending somebody to someone who claims that they might have a test. And again, this only reveals if the virus is currently present. A negative test doesn't mean that you won't get it later on. You should consider an incidence of a false positive or a false negative associated with a particular test. And I also wanted to point out that the state of Michigan has expanded who can get a test to those who are simply working at a critical infrastructure work site. Those people, even if they're not symptomatic, can go get a test. Another thing that you can do is, or when you're looking at dealing with employees when they're coming back, is a question that we've received a lot lately is, what do we do with people in vulnerable categories? The CDC has defined who's in the vulnerable category. There's many people who can fit into these categories. A couple that are relevant for us under these circumstances are those who are 65 and over, and those with underlying health conditions. And the big question is, can we force them to stay home? From the employer standpoint, the general answer to that is no. You can't force someone who wants to come back to the workplace and fits all of the other requirements for being allowed to be in the workplace simply because they're in that protected or that vulnerable category. An employer can't say, well, you don't get to come back, but somebody else does. You can't make that distinction from the employer's perspective. The answer to that really is to engage in the interactive process contemplated by the Americans with Disabilities Act with those employees to determine what kind of accommodation can be made that's not an undue burden on the employer. Steve's going to talk a little bit about this particular issue when he gets to what happens on the flip side when the employee doesn't want to come back and what do you need to do with respect to that issue. I'm specifically talking about here, what can the employer do when the employee does want to come back, but they're in this vulnerable category. Ultimately, there's practical considerations. A lot of times when you're looking at legal issues, common sense doesn't come into play. I'm sure most all of us have seen results where you're saying, well, gee, that doesn't make much sense, but the law says something else. Here, I think common sense does come into play, and being practical and using good judgment will come into play. And when you're talking about bringing employees back, really you want to have, as Amanda said, a conversation with the employees, understand their individual pressures and issues. As you'll see listed there, their own individual issues, childcare issues, again, those who are vulnerable themselves or have vulnerable individuals in their household, and those who live with medical professionals. And really it's about, under these circumstances, especially when we begin to bring employees back into the workforce or into the physical space, that they trust that the employer has the safety and well-being of those employees first and foremost in their mind, and are putting procedures and processes in place to make sure that those things are carried out. We have found more often than not that legal issues and disputes are avoided simply by the employer listening to the employee and making it clear that their concerns have been heard and taken into account. And with that, I will turn it over to Steve.
Good morning. Okay, so now we're going to talk about the flip side of this whole deal, and that's you're up and you're ready and you want to go back to work, and your employees don't want to come. And how do you handle that? And I know some of you have faced these issues already. If you've got a PPP loan, for example, and you had employees who were on unemployment and you called them and said, hey, you're going back on the payroll. You've probably had employees who said, I don't want to go back on the payroll. I'm making more on unemployment than I made when I worked for you. Thanks to the federal government and their $600. That's true. So the question then becomes, who can we force to come back to work? So what you've got up in front of you on the slide now is my list of excuses, if you will, valid excuses, not the dog ate my homework, but real excuses for why people might not have to come back to work. And we're going to talk through those quickly. And then we're going to talk just briefly about what you can do to get people to come back to work. And your options, I'm going to be honest with you, are very limited. So let's start with the list of excuses. And we're going to start with the executive orders that the governor has been issuing. There's one real specific executive order here that deals specifically with this issue. And that is that you cannot discharge, discipline, or otherwise take adverse action against an employee for two really specific reasons related to COVID. And they make sense. You don't want these people back anyway. So under Executive Order 2020-36, what you're allowed to do, or what you're not allowed to do, is make an employee who has a positive test or who has the symptoms of the virus come back to work. Makes sense, right? Don't want them back anyway because they're going to infect everybody else. And there's some limits on that. All right, once they've gotten through the quarantine period, once they've got a negative test, and so on, then you can bring them back. You also can't make an employee come back to work if they're caring for somebody who has a positive test or who's exhibiting symptoms of the virus. And again, that makes sense. If they're exposed to it, you don't want to have them come back. Now, there's a really important provision in this executive order that you need to be aware of, and that's that third bullet point there. The order doesn't prevent an employer from disciplining or discharging an employee who's allowed to return to work under the conditions of the order, but refuses to do so. In other words, I don't want to come back to work, I'm scared, isn't a good enough excuse. And we're going to talk about that later too. You can also discipline an employee with the employee's consent, which might be the dumbest thing I've ever seen in an executive order, but you can do it if they'll let you do it, or for any other reason that's not unlawful. So that opens up your menu, if you will, of discipline. Now, this executive order doesn't have a fixed end date. It continues to the end of the state of emergency and disaster. That's interesting because that ends May 1st, April 30th, actually. The governor has asked the legislature to extend the state of emergency. At least when we came in here, I don't know if they've done that or not yet. There is some pushback, if you will, from the legislature about whether or not they want to do that. So we'll see what happens. But at least for now, that executive order is still in place. All right. The next category of people that you can't make come back to work. And again, this makes some sense. If you have under 500 employees, and that 500 employee limit is an interesting and maybe moving target. If you have under 500 employees that are eligible for paid time off under the FFCRA, which you all know is the Family First Coronavirus Relief Act. And that's the act that gave expanded family medical leave and gave sick leave. 10 days of paid sick leave is available to employees in 6 categories. Some of the paid sick leave is full pay. Some of it is partial pay, 2/3, depending on what you're out for. And then there's some up to 12 weeks of expanded family leave if an employee is the principal caregiver of a child and they have to stay home because the child's school is closed as a result of a government order, or their child care is not available as a result of COVID-19. Again, that statute has a specific no retaliation provision in it that prohibits you from retaliating against an employee if they're using the leave or if they ask for the leave or for reasons contained under the act. So anybody who falls under one of those statutes, you can't make them come back to work. Now, here's what's interesting about that. Under the FFCRA, an employee who's out of work because you don't have work is not entitled to this leave. So if you've laid a bunch of people off, the people that are laid off aren't entitled to this leave until you call them back. And then the day you call them back, they are entitled to this leave if they're otherwise eligible. So you might have somebody who comes, you want to bring back to work, and they say, no problem, I want sick leave under the FFCRA. And if they qualify for it, you're going to have to give it to them, that 10 days of paid sick leave and maybe up to 12 weeks of expanded FMLA leave. And don't forget, just because you weren't eligible for the FMLA before, because you don't have 50 employees, doesn't mean you're not covered by this statute. You are. This statute covers anybody with under 500 employees. So those of you out there with 20 or 30 employees, you're going to have to give FMLA leave, but only for this specific reason, not big FMLA leave, just expanded FMLA leave if somebody has to stay home and take care of a kid because their school is closed. Okay, then we got the real FMLA, all right? Where are we on the real FMLA? Well, here's what we do know for sure. What we do know for sure is that COVID-19, if you've got it, that's a serious health condition. There's no doubt about it. And again, you don't want these employees back anyway. And as we all know, under the FMLA, there's a bunch of requirements that an employee has to meet in order to get FMLA leave. They've got to have been with you for a year. They've got to have worked 1,250 hours. They've got to have all that stuff. You have to do medical certifications and all that stuff. That still applies here, okay? That still applies here. Now, there's some inner workings between these executive orders and the FMLA that don't necessarily work. Under some executive orders, you can't ask for documentation, but under the FMLA, you still can. And an employee who otherwise qualifies for leave gets FMLA leave if they've got COVID-19. Now, this only applies to employers with 50 or more employees, okay? The fact that the FMLA leave has been expanded for the very specific reason of childcare for people with less than 50 employees doesn't mean they have to give normal FMLA. If you were covered by the FMLA before, you're still covered by the FMLA, and you still have to provide that leave if the employee meets the eligibility requirements. Makes sense, right? The other thing you need to know is that under the FMLA, if you terminate an employee while they're on FMLA leave, the burden shifts to you to prove that you would have terminated them or laid them off even if they wouldn't have been on FMLA leave. That's not a play. I'm in a room with two litigators. They don't like that when those burdens shift. They don't care for it at all. So if you're going to let people go and you're starting to pick people because they're on FMLA leave, we're going to call it a permanent layoff now or whatever, that can cause you some trouble. Those employees are entitled to the leave and they are entitled to be off. Now, the same rule applies here as if the expanded FMLA with regard to employees who are laid off. Obviously, an employee who laid off is not entitled to FMLA leave. They're laid off. There's no leave to give them. But when you call them back to work, they might be eligible for FMLA leave, and they're protected against retaliation. So that's the third excuse. The fourth, and Ed touched on these things already too, is if the employee is disabled under the ADA. And you already heard Ed say, hey, COVID-19 is a disability under the ADA. And you're all asking me, how's that possible? The flu isn't a disability. How could COVID-19 be a disability? Well, under the ADA, I don't know how many A's there are, but the Amendments Act, the definition of disability was significantly broadened. And COVID-19 is absolutely serious enough that it will be classified as a disability under the ADA. Two things to remember about the ADA. Number one, leave is and can be a reasonable accommodation. So you may have to give an employee, even if they're not eligible for FMLA leave, they might be eligible for leave under the ADA as a reasonable accommodation. And two, we've all taken the position for a long, long time that most jobs are required to be done at work, that you can't work from home, that attendance at the work site is an essential function of that job. Well, we kind of blowed that up now, haven't we? We got an awful lot of people working from home now that we would have said in the past couldn't do that. That means you're going to have to rethink what a reasonable accommodation is under the ADA with respect to telework, and there is no doubt about that. The other thing that Ed pointed out and Amanda pointed out is before we start talking about things like telework as a reasonable accommodation, just because these restrictions are starting to be lifted doesn't mean you want to bring everybody back. If you can have somebody continue to telework, you might want to think about doing that and just not rushing everybody back. Here's the bottom line. An employee can't refuse to return to work just because they're afraid. Remember, go back to that executive order. An employee has to be covered by the specific provisions of the executive order in order to be able to stay home and not be retaliated against. They've got to have a serious health condition under the FMLA. They have to have a disability under the ADA. I'm afraid to work isn't necessarily one of those things. Two things I'd remind you of. If they come in with a doctor's note that says they've got a significant phobia, we have to start thinking about the ADA again. They might, being afraid in that case might be good enough. And the other thing you need to remember is a bunch of employees who are afraid to come to work, who get together and decide they're not going to come to work because they decide it's not safe, might be protected by the National Labor Relations Act. All right? So what am I talking about here? The National Labor Relations Act, Section 7 of that act, protects all employees who are engaged in protected concerted activity. What's protected concerted activity? Protected concerted activity is 2 or more employees complaining to their employer about a term or condition of employment. There's a very, very old Supreme Court case that says those employees don't have to be members of the union to be protected, or a union. Non-union employees have Section 7 rights. The old Supreme Court case involved a company with no heat, and the employees didn't want to work because it was too cold in the middle of the winter, so they all walked out. The employer fired them, and the employees were all brought back to work and reinstated because the Supreme Court of the United States found that the employer had violated Section 7. That could be the case here too. Over the course of my 30-year career, I've seen this 2 or 3 times. Usually it involves situations where it's too hot and employees don't want to come to work, but this particular area is ripe for a claim of protected concerted activity where 4 or 5 employees walk off work. And as a matter of fact, we haven't seen it in this law firm, and I haven't heard of it in Michigan yet, but you all might have read of the Amazon workers who are not unionized, who all staged a 1 or 2 day strike because they didn't feel it was safe at work. And those employees are protected. You can't just fire them. Okay, so what can you do? Well, you're really limited to a couple of things. And one of them involves unemployment. A bunch of the unemployment provisions have been waived by executive orders. Employees don't have to certify that they're looking for new jobs. Employees don't have to prove that they were, fired for without misconduct, engaging in misconduct. There's a bunch of things employees don't have to do now. None of those executive orders have said, if your employer has work available for you, you can refuse the work. Now, there's a couple of executive orders that expand what you can get unemployment for, and those executive orders, there's been 3 of them now, one on top of another, and they've replaced the preceding one. Again, those are very specific executive orders that involve having the disease or being able to transmit the disease or being immunocompromised. And I want to talk a little bit about immunocompromised and flip back up. An employee who's immunocompromised, who has one of those vulnerable categories that Ed talked about, might also be protected under the ADA. And if they have a doctor slip that says they can't come back to work, we might have to do a reasonable accommodation or an FMLA leave for them too. So back to unemployment. What you can do is you can contest an employee's claim to unemployment. I've got work available to the employee, for the employee. The employee has refused that work. They won't come back to work. They shouldn't get unemployment. Now, I say you can do that. Good luck. Good luck trying to get through to the unemployment agency. But the unemployment agency also has a fraud line. And you can remind your employees that you're going to report them to the unemployment agency if they refuse to come back to work, and you're going to at least work to get their unemployment stopped. And you can also remind your employees that there's some significant penalties if they fraudulently obtain benefits. And the definition of fraud here is pretty broad. In other words, if they get benefits they shouldn't have gotten, that's fraud. And there's a 4 times kicker under the fraud provisions of the Michigan Unemployment Act. The employee can be required to pay back up to 4 times the amount of the benefit they fraudulently got. When you're getting $900 a week and you spread that out over a couple of weeks, that's real money that the employees might be required to pay back. And there are potential criminal penalties, but nobody's going to jail for this. Also, under the CARES Act, if an employee commits fraud, they lose further benefits under the CARES Act. And remember, the CARES Act is the federal act that's giving all these employees the extra $600. So they lose further benefits. They have to pay back what they received. And again, there's potential criminal prosecution under those statutes. The other thing you might want to think about doing, depending on what you've done, is with healthcare. A lot of you have extended employees' healthcare even though they're laid off. In a normal situation, we wouldn't have done that. Employees wouldn't have been eligible for healthcare, and COBRA would have kicked in right away. But many of you have extended healthcare benefits. You might want to think about saying to employees, hey, look, we've got work available for you. We're bringing you back on this day. If you refuse to come back, we're stopping your healthcare. We don't think that's discriminatory. That's reasonable. You have a valid business reason for doing it. You've got work available for the employees. You shouldn't have to continue to pay for their health care if they've refused work. So those are really the two pieces of ammunition, if you will, that you have to kind of incentivize people to come back to work. I suspect most of your employees, well, I shouldn't say that because I'm hearing it both ways. I'm hearing employers who are saying, hey, I'm not having any trouble getting people to come back to work. They're being really good about it. And I'm hearing other employers say, I can't get people coming back to work at all. And these are employers now. Remember, the executive orders are still in place. You're not supposed to be up and running, but critical operations have ebbed and flowed. And so these are employers that are bringing people back for critical infrastructure work. So we've got some questions and some answers. So before we get into our questions and answers, you guys have asked some questions and answers. So what we'll do is we'll read those questions, and then between the three of us, we'll try to figure out if we've got an answer for you. The first one we got is, what do you do for testing and handling of employees who are asymptomatic, since many of those cases go undetected?
Well, for purposes of the counties that are requiring screening, that screening applies to all employees who enter your facility. That screening is not limited to only those people who have exhibited a symptom. The CDC guidance that just came out on Monday, I believe, that added a list of additional issues, for instance, muscle pain, a loss of smell. Those are some new symptoms that the CDC just added to their guidance. They've indicated that if an employee has, or if someone has 2 of those symptoms, that they should seek medical treatment and get tested. You will want to do that screening for every single person that walks in your facility, recognizing that someone may have it and may not have those symptoms. But this is the best you can do in an effort to avoid or at least minimize your risk of a COVID-19 outbreak within your facility.
The other issue with testing, if we're talking about an actual test, and I don't know if any of you have seen the videos of them giving the test, but it doesn't look that pleasant to me, where they're shoving that thing up your nose. As Ed pointed out, the governor has loosened who can get a test, but tests are still limited. But the EEOC has now come out and said you can make people take a COVID-19 test. Before all this, you wouldn't have been able to do that. Medical tests have to be job related and justified by business necessity. That requirement has been lifted. COVID-19 tests can be required, but you're going to have a hard time finding tests. And I want to remind you, and I think Ed did this too. We're talking about COVID-19 tests here. We're not talking about antibody tests. We're not talking about some guy who says he's developed an antibody test and he can promise you that all your employees who have the antibodies are safe. That's not what we're talking about. We're talking about actual COVID-19 tests, and you can require those, assuming you can find them.
And with the protocols that we talked about earlier, and we're happy to work with protocols with whoever needs that assistance, you should identify that very specific screening process. And we would recommend thinking about whether there is disciplinary action for someone who is untruthful in that screening process as they enter your facility. And again, keep that in a separate medical file for that individual when you do that screening.
Okay, the next question we got is, where can we get information for guidelines from Governor Whitmer's office on different recommendations for the different types of businesses? That's a great question.
And that's going to be continuous over the course of the next 2 weeks when she looks at the very specific risk levels for each workforce. There is a lot on her webpage right now with the executive orders for those that are operating critical infrastructure. But as we move forward in the phasing process of what that looks like, those organizations that are low risk are going to be those organizations where people are not working within 6 feet of each other. And for instance, our law firm is probably going to be a low risk. But again, our law firm can telework. All of us are teleworking right now. So that's when your entity is going through that decision-making process, and as she reduces restrictions, it's going to be taking in place what she's already required: social distancing, PPE, the criteria for limiting travel that's also been outlined by President Trump. So that will be available in her webpage, as well as she is doing the political circuit of all of radio interviews, and every single time she does one in a press release, a little bit of additional information is shared with us to consider.
Yeah, you can go to, if you want specific websites, go to michigan.gov. They have a COVID-19 link on their website, or you can go to WNJ.com, and we have a COVID-19 link, a resource page, if you will, on our website too, that you could get. All right, next question. Can you require employees to wear a mask on the job? What if they refuse?
You can require them to wear a mask on the job. If they refuse, you can discipline or discharge them pursuant to your policies that you would already have in place with respect to any kind of PPE. Or if you don't, you could have a particular policy in place right now related to wearing masks in the workplace. We do want to caution folks, though, that there are still Americans with Disabilities Act considerations that you need to keep in mind when you're requiring employees to wear a mask. For example, if they have COPD or asthma or something that makes them not able to tolerate wearing a mask medically, you would have to engage in the interactive process with them and determine if there is an accommodation that you could make without an undue burden to the company. You'll also want to provide at least some posting or some training with respect to how to properly wear a mask, even though we assume people know how to do that. We probably want to have that available for employees as well, since we're assuming that most places are going to have requirements for employees to wear masks, at least in certain parts of their facilities, if not the entire time.
The same questioner asks, who's required to provide masks and or cover the cost of them, the employer or the employee? And this is a simple answer. It's in the governor's latest executive order. The employer has to do that. Now you can allow an employee to wear a homemade mask if you want, but you have to provide masks and you have to make them available to your employees. Next question is, what about sales agents who are independent contractors regarding entering the office in Ingham County? There's silence in the room, so I'll take this one. My recommendation to you is you don't let anybody who's not an employee in your building at all. Sales agents, telephone calls, Zoom meetings, stuff like we're doing right now. I would not let anybody in any of my buildings that's not an employee that has to be there.
And part of this is, I'll add to that from a litigator perspective. There is going to be a rise of employment litigation when we get through this, or as we go through this. There are immediate decisions that are being made about furloughs and layoffs and bringing people back. And you are going to get lawsuits or EEOC charges for treating people differently or not complying with your own procedures. For heaven's sakes, what we don't want is a COVID-19 outbreak at your facility. And if you have an independent contractor salesperson that is interacting with other people and you allow them back into your facility, the impact that you could have on your employees could be disastrous.
Next question. If you have a working employee who ends up testing positive, what do you do with the employees who have had contact with the positive testing employee?
You absolutely need to tell them that they've had exposure. That's required. When you tell them that they have been exposed, again, you cannot tell them who, but you have to tell them that they've been potentially exposed. They are supposed to quarantine for 14 days and to identify, basically self-detect symptoms, and if they then have any symptoms, to get the medical attention. Again, depending on what your facility does, you may be able to get additional testing under the current updated guidance on who can get testing within the state.
Okay. What are the guidelines regarding quarantine after exposure to someone in your home who has COVID-19? We know quarantine for 14 days after exposure, but if an employee lives with a person, then they are continually exposed. So 14 days from when? First exposure or after symptoms end? I think the CDC guidance specifically deals with this. I don't know what it is right off the top of my head, but I think you've got to be 72 hours symptom free after a positive test. And I would think the same thing would be here after a negative test, maybe it's, so I would think that the same would apply here, but my recommendation to you would be go to the CDC website. There's a bunch of guidance out there. One is, has to do with guidance for community transmission. And there's actually a chart that tells you what you're supposed to do depending on who you're in contact with and for how long. And that'll be able to tell you exactly what to do. And as Amanda just pointed out, the last thing we want is an outbreak. So I'd be careful as opposed to aggressive here. One more question here. Well, it looks like they're still coming in. Somebody just asked, what about mail delivery and food delivery? And I think they asked that when I got done saying, I don't want anybody in your business that's not an employee. And my suggestion would be mail delivery, food delivery stops at the front door. All right, so we've got a lot of businesses reopening now with quote unquote curbside pickup. There's no reason food delivery and mail delivery can't be delivered to your curbside. As a matter of fact, my favorite cigar shop is now open again. I was very happy that I could get my curbside cigars last night. You don't want people walking in and out of your building. And if they are coming in, you certainly want them to put a mask on. So that would be my recommendation to you there. Let's see what else we got here. Can we require a questionnaire form from independent contractors? Are you talking about, if you're talking about a screening form, I think the answer is yes. You can require screening from anybody who walks into your private building. And if they don't want to answer the screening questions, then don't let them in. In a small mom and pop store with 5 employees, if one person tests positive, then does everyone in the store have to self-quarantine and close the store? Maybe. If everybody had close contact with the employee, then the answer to that is yes. If they work on different shifts, maybe not.
So remember, close contact is 6 feet for a prolonged period of time, which the CDC says is 10 to 30 minutes. So if you've had close contact for a prolonged period of time with someone who's confirmed COVID-19, you have to self-quarantine.
And that's all the questions so far.
Any final questions before we wrap up for the day?
Type them in quick.
Again,
Oh, here we go. Employees that work for physicians' offices that want to reopen and the employees are refusing to work. Some say because they make more money. Others say they're concerned being around patients. Can you replace these employees? That's a great question.
it will part consider what are you doing within your physician's office. There is not a blanket exception in the executive order to healthcare workers. It says some. And so I do not believe that every physician's office would be considered a critical infrastructure, depending on what you do within that facility. So that would be my first consideration, to make sure that you are designated as such.
The other thing you have to keep in mind is, do they fall into any of those protected excuses that we talked about at the end of the presentation? If they do, you can't replace them. If they don't, maybe you can. But again, you gotta be careful about when you're opening. Okay, the executive order hasn't changed in that regard, unless you work for a lawn care business or an outdoor enterprise that has been accepted now. You're still not supposed to be operating unless you're critical infrastructure. So keep that in mind as you start bringing people back. Deb, can we repeat what close contact is considered?
Close contact under the CDC is within 6 feet for a prolonged period of time, which has been defined by the CDC currently as 10 to 30 minutes.
The next question is, so if every employee uses the same cash register, is that close contact? It's probably. Let me give you a suggestion if I were you. Don't let every employee use the same cash register. Designate an employee to check people out. If you can do that, I would suggest you do that.
And that also brings up a point that we had talked about earlier with time cards. If you have a clock in, clock out that everybody's using the same one, eliminate that process.
Or gloves, or, you've got to be some protective thing you can put in place for that cash register. Ed? Okay. My son has severe breathing issue. Am I covered under the ADA to care for him? The ADA doesn't apply. It only applies to your serious health condition or your disability, not somebody else's disability. So if you've got employees who have children or family that are vulnerable individuals, the ADA doesn't protect them. The FMLA might, if they need to stay at home and take care of those people, but not the ADA. Thank you all very much.
Amanda, Ed, and Steve, thank you so much for the presentation and the detail and breaking down, as I think we see with each one of these, complicated and many questions. So thank you so much for your time. Just again, as a reminder to all the attendees today, we have videotaped, or we have recorded the presentation. We will make this available to you in a follow-up email, as well as the slide deck from Ed, Amanda, and Steve. So I hope everyone has a great day, and thank you for joining us this morning.